Hey everybody, today we're talking about how to know it's not sesamoiditis. And this is really important because with sesamoiditis there are a few different differential diagnoses because it's quite a complex joint that takes a lot of force, and so there's a few different things that can be happening around that big toe joint or the first metatarsophalangeal joint. Now, sesamoiditis is really an inflammation of that sesamoid, and so it doesn't quite encompass things like a sesamoidopathy, which is our umbrella term, which may be talking a little bit more about sesamoid fractures or stress reactions. These are really, can be seen if they're quite obvious on X-ray, potentially on ultrasound, but otherwise you might be needing a CT or an MRI to have a bit of a further look at, whether there might be a fracture. A simple palpation is often not enough, but particularly if that patient's taken longer to heal, then, and decrease their pain, then that could be something that you would be considering as a differential. One of our other concerns might be that there is Flexor Hallucis Longus Tendinopathy that's just painful a little bit further back. This is a great condition because we can, one, double check that muscle belly up through the lower leg, but also do some resisted strength exercises, by pushing up on the tip of the hallux and getting that patient to push against your hand or your finger in that area as well. If it's painful, then it's more likely that there could be a Flexor Hallucis Longus Tendinopathy. Now, not always will this be in isolation, and there may be some sesamoiditis there as well, so just make sure you're getting a really clear picture of where the pain is. One of our other things that I've seen is a ganglion that's extending really from the distal hallux right up through that sesamoid area, where there was pain quite present around the sesamoids, but the telltale sign of a ganglion is that extra swelling. And particularly if there is quite a bit of swelling, you can really see what's happening and get a better idea. Otherwise, if you're not sure clinically, that's where an ultrasound will really help to differentiate between sesamoiditis and a ganglion presence. Really, using that imaging is your best option in this case. Hallux Valgus is another thing, also known as bunions. Really, that's going to be where that joint, or the hallux is moving across. There's going to be some subluxation or mild dislocation. You might have that red, swollen dorsomedial bump of the first metatarsal. And you're going to be able to see that there's a bit of deviation. Again, X-rays are really good if you're not clinically sure on what we're looking at there, but typically this is really something that you're seeing and you've been able to say, okay, yep, that's definitely a bunion, but there could be some sesamoiditis there as well. And so, have a clinical suspicion. I know there's, definitely in later stage Hallux Valgus and similar in Hallux rigidus deformity. I do see a lot of arthrosis of the sesamoids, which is going to be a type of sesamoiditis that the patients are typically feeling, towards that later stage deformity. Now, around this joint, it is a very load-bearing joint, and so there's going to be a few effusions, there could be some capsulitis, there could be some plantar plate injury, and so that's where your palpation is going to be really important to differentiate between the different structures, but then also get a better idea with your ultrasound, and clinical ultrasound's great, or referring external to just get an idea broadly of what's happening at that joint. Again, X-rays will be able to potentially pull in some of the later stage sesamoiditis or whether there may be fractures, but an ultrasound is going to give you a really good indicator of whether it's actually at the sesamoid that these concerns are occurring. If the pain's a little bit more towards the dorsomedial aspect of that first metatarsal distally, then it could be that you're looking at a Joplin's neuroma. Patients are going to tell you that it's more of a stinging, sharp shooting, or there may be pins and needles. And in chronic cases of Joplin's neuroma, then the medial aspect of the hallux is going to be numb. And that's going to be really telling for that Joplin's neuroma because we typically don't find the similar symptoms to the sesamoid area. But these have been a few ideas around, what could it otherwise be for sesamoiditis, a few of the differentials. Of course, if you've liked this video, please hit the subscribe button, have a look at some of our other videos, and we'll see you in the next session. Cheers.